Page 1. Introducing the guide and the table of contents briefly. Page 6. The Memorandum of Understanding is explaining that once the medical assistant is placed in the office, they are to only perform duties for nationwide purposes, and that performing administrative or clinical duties on behalf of the physician is prohibited by the anti-kickback law. It is imperative that the MA understands they are an employee of Nationwide Laboratory Partners and not of the physician. Page 7. The HIPAA Confidentiality Agreement is a form signed by the MA to keep all patient-sensitive information confidential. Chapter 2. Getting Started. Page 9. This is a brief look at our urine screen requisition form. We will go more in depth in the urine collection chapter. Pages 10 and 11. This is a brief look at our blood panel requisition form. We will go more in depth in the blood collection chapter. The digital signature authorization form is to be signed by the physician and returned to contact@elitemedicallab.com. This will keep the ordering physician's signature on file when ordering tests online. Page 13. This is a brief look at LifeBright's requisition. LifeBright is a partner that Elite Medical Laboratory uses for government-insured samples. In order to complete the requisition, the MA will need to provide the following information. 1. ICD-10 diagnosis codes. 2. Patient information. First, last name, address, date of birth, and gender. 3. Patient signature. 4. Specimen information, collector's initials, date and time collected, urine temperature. 5. Select testing option. Always check off comprehensive, quantitative profile. 6. Qualitative analysis. Always check off reference laboratory. 7. Provider's signature is mandatory. 8. Lastly, please provide insurance information, medication list, and demographics. Page 15. Ordering supplies is made easy by visiting our website at www.elitemedicallab.com and selecting the Order Supplies tab. The MA will then request the supplies needed. Once the MA clicks the Submit Order tab, our laboratory will receive the request and ship out the appropriate supplies. Page 16. The supply inventory log will allow the medical assistant to keep track of office and medical supplies on a daily basis. Page 17. The order modification request is a form that allows the medical assistant to add modifications to the original order. The MA can add diagnosis codes, tests, prescriptions, and demographic information. Page 19. The patient billing acknowledgement form explains to the patient that they are authorizing Elite Medical Laboratory Solutions to analyze the specimen. The form also explains that they will be receiving an explanation of benefits. This is not a bill, it simply communicates what the standard charges are for the lab's tests. Page 23. Elite Medical Laboratory only accepts PPO insurances for blood samples. Elite Medical Laboratory does not accept HSA or FSA payments for blood or urine samples. Pages 24 through 25. The laboratory's self-pay policy form allows the MA to collect payment from the self-pay patients. The form also explains the total amount that will be billed, and the credit card information will not be kept on file. Page 26. Here we have a list of commercial and government insurances. All commercial insurances will go to Elite, and all government insurances are to be sent to LifeBright. Page 28. The urine collection checklist is to be checked off and signed by the medical assistant. This checklist was created to reduce errors in the process. The checklist is to be sent off with every specimen for the first 2 weeks of the collection process. Page 29. This is a look at the Elite requisition. In order to complete the requisition, the MA will need to provide the following information. 1. ICD-10 diagnosis codes. 2. Patient information. First, last name, address, date of birth, and gender. 3. Patient signature. 4. Specimen information. Collectors, initials, date and time collected, urine temperature. 5. Select testing option. Always check off use my test order on file. 6. Provider signature is mandatory. 7. Lastly, please provide insurance information, medication list, and demographics. Page 31. The pass or fail checklist is to ensure the clinic is in complete compliance with the Texas Medical Board. Page 32. The RU form explains the testing guidelines for different medications prescribed. Page 33. Tighten the lid on urine collection cup until you hear 2 clicks. Then place tape across the top of the specimen cup in order to prevent spills. The MA will then place cup with completed requisition form, patient demographics, patient's insurance information in the biohazard bag. Roll bag as seen in picture and tape to secure. Page 35. The following is the venipuncture checklist. This form is to ensure the MA is following the correct collection process in order to prevent errors. Page 36. The blood shipping checklist ensures the MA is correctly shipping blood to the laboratory. Page 37. This is a look at our blood wellness panel requisition. All of the highlighted fields are required. Number 1. Patient information. Number 2. Patient's consent for testing. Number 3. Diagnosis codes. Number 4. Medication information. Number 5. Ordered blood panel must be checked off. Number 6. Specimen collection information. Number 7. Physician signature. Number 8. Once requisition is complete, attach copy of patient's demographic and insurance information. Page 38. Top 5 reasons samples are rejected. 1. Patient identifiers are missing: name, date of birth, collection time, collector's initials. 2. Requisition form is incomplete. 3. Ice pack is not frozen or included in shipment. All blood shipments must be shipped with a frozen 6-ounce ice pack inside of the foil pack. 4. The specimen is not spun correctly or has not clotted. 5. Specimen was not received within 3 days of collection. Blood is recommended to be sent out same day. Page 39. The blood collection checklist is to be checked off and signed by the medical assistant. This checklist was created to reduce errors in the process. The checklist is to be sent off with every specimen for the first 2 weeks of the collection process. Pages 40 through 41. The blood testing guide is a depth look at all the blood wellness panels that Elite Medical Laboratory has to offer. Page 44. Elite has created an allergy questionnaire for our patients. The questionnaire has a total of 8 questions. If the patient has answered yes to at least 3 of the questions, they should consider having an allergy test during the office visit. Page 45. This is a look at our comprehensive allergy panel requisition. All of the highlighted fields are required. 1. Patient information. 2. Patient consent for testing. 3. Diagnosis codes. 4. Specimen collection information. 5. Medication information. 6. Comprehensive allergy panel must be checked off. 7. Physician signature. 8. Once requisition is complete, attach copy of patient demographics and insurance information. Page 46. The following is the allergy venipuncture checklist. This form is to ensure the MA is following the correct collection process in order to prevent errors. Page 47. The blood for allergy shipping checklist ensures the MA is correctly shipping blood to the laboratory. All blood must be sent out the same day as collected. Page 49. Here we are taking a look at a completed online requisition. All highlighted fields are required in order for the laboratory to run specimen. Pages 50 through 53. The following is a step-by-step overview of how the clinic will access tests and submitting test orders. Each account will be provided an individual username and password. Page 55. Please fill the blood questionnaire to the best of your knowledge. Page 56. Please fill the toxicology questionnaire to the best of your knowledge. Page 57. How did we do? Please give us an opinion on our MA survey. Page 59. Contact us if you have any questions. We have provided the links to all of Elite's training videos below.